Let's get a word on this and the other big stories of the day. Simon Danzcuk, former Labour MP, is with us. Afternoon to you, Simon.
Good afternoon. It's good to join you, Ian.
Always good to have you with us. So we are talking the Royal College of Nursing, of course, laying out the details of and experiences of their members. It's a 460-page dossier. It's very thorough stuff. 5,000 staff questioned about this. Dead patients lying in A&E, NHS staff overstretched, a severe shortage of beds. The sick are being left like in animal-like conditions, in hospital car parks, in cupboards, in toilets, for goodness sake. I mean, this is a horror story. It's worth just having a listen, Simon, to what Wes Streeting's made a number of speeches, of course, on this. He's the Health Secretary. This is what he said on the state of the NHS at the end of last year.
The NHS is going through what is objectively the worst crisis in its history. And whether it's people struggling to get access to their GP, dialling 999 and an ambulance not arriving in time, turning up to A&E departments, waiting far too long, sometimes on trolleys in corridors, all going through the ordeal of knowing that you're waiting for a diagnosis that could be the difference between life and death.
Well, there it is. I mean, diagnosing the problem is the easy bit, Simon. Doing something about it is a little trickier.
Yeah, absolutely. It needs a radical overhaul, doesn't it? And it's obviously a complex picture, as you outlined in the introduction to this. There's no quick or easy solutions. But what is for sure is that it can't carry on as it is. And I think we need to persuade the public. And politicians of all colours need to play a role in this. The NHS cannot be sustained as it is. You can't just keep throwing money at it. So it's right, you know, it's helpful that the Royal College of Nurses produces this report and shows us how grim it is. I think it's really useful information and data. But if you then say to the Royal College of Nursing, we need to radically shake up the NHS, I suspect they would say, oh, hang on, we don't want radical change, we just want more money. Yes. Well, that isn't a solution to this. Yeah. You know, we have to look at models, whether it's in Canada, Australia, perhaps France, and radically overhaul how we do healthcare in the United Kingdom. And that might involve, well, it should involve more of the private sector. I'm convinced of that. People who pay into the private sector for healthcare perhaps should get incentivised for doing that to take pressure off the public sector. But it needs a radical overhaul. You can't keep just patching it up or throwing money at it, that's for sure.
And the problem, of course, is that even if somebody does come up with a great idea as to, you know, what addresses the point you correctly make, Simon, about a radical overhaul, this isn't something that's going to happen in the next few months or even the next couple of years. This could take, a decade or more to get into place.
Yeah, absolutely. And one of the problems in relation to this report is a shortage of beds. So people are being put in corridors, and it's absolutely awful what's happening to people. I mean, people's lives are being shortened by the fact that they're going into hospital. How perverse is that? But it's a shortage of beds because we have people in hospital who can't then be moved out into social care. Yeah. And the government, Wes Streeting, who I rate as a minister, actually, I think he'll do some good in terms of shaking up the NHS. I don't think he'll do enough. I think he'll be restrained by a more left-wing cabinet and a more left-wing prime minister. But I think he'll generally have a positive impact on it. But he's just devised a social care strategy which doesn't come to fruition for 2 years. He's kicked social care into the long grass, which means we're still going to have people blocking beds in hospitals, creating this problem that we've got now. And this social care issue, which is a key dimension to this issue, is just not being addressed. And that's gone on with previous governments for a number of years now.
Yeah, absolutely. Well, we're asking that question. How do we resurrect the NHS? Our lines are open with suggestions on that. Let's move to this story. Big news, of course, yesterday, Simon. Netanyahu and Hamas coming up with some kind of ceasefire agreement. But today, it's looking like there are already some rocks in the road on this. Netanyahu accusing Hamas of backtracking on the ceasefire agreement. It's worth having a little listen to President Biden making his announcement last night when it was believed the terms of the ceasefire had actually been agreed on at that point. Let's have a listen to what the president said.
After 8 months of nonstop negotiation, my administration, a ceasefire and a hostage deal has been reached by Israel and Hamas, the elements of which I laid out in great detail in May of this year. This plan was developed and negotiated by my team and will be largely implemented by the incoming administration.
There it is. I think the incoming administration, Simon, worth just mentioning, had quite a lot to do with this as well. But I don't imagine Biden is going to be shouting that anytime soon. Nonetheless, I mean, look, these things are never straightforward. Even the form that it's taken under Biden's plan is not straightforward. But already there are rumblings that Hamas are not playing ball, and Netanyahu is suggesting that they are backtracking on their agreement.
Yeah, that's exceptionally unfortunate, isn't it? I mean, we have to remember that this has all been started on the 7th of October 2023 by Hamas attacking Israel, and it's, you know, there are no rules in war. If you start a war, then you can't determine when it's going to be finished, and Hamas have had to live with the consequences of that. It was looking extremely hopeful, wasn't it? A three-stage peace program. First stage, release some of the hostages, release some Palestinian prisoners, and have an immediate ceasefire from I think it was the 12th, I'm getting my dates wrong now, from mid-January. That looked really positive. Then a second stage where more hostages were released, people going back into Gaza, and then a final third stage where you could start rebuilding Gaza. But it's a shame it's a real shame that that's falling apart now. On the bigger issue that you make in relation to who's responsible for making this peace happen, I do find it a bit unsavoury whether it's Biden or Trump fighting over the glory around who's made it happen.
Yeah.
I mean, the truth is a number of players have played a part in this. Undoubtedly, Trump's elections played a part because people see him as somebody who wants peace and is very unpredictable. So Netanyahu and Hamas were worried what Trump might do when he gets into power in just a few days. Yeah,
it's going to be interesting. Yeah, it was the comments that he made about unleashing hell if they didn't sort it that many took very, very seriously as to, you know, the direction of travel that could have been maybe the accelerating factor behind this. And, you know, Biden's team, of course, they're the current administration. They're meant to sort this kind of stuff out. It wasn't like a sort of an added extra that Biden did, or just before I go, I'm going to solve an international war zone issue. That's part and parcel of what he's meant to do. So you're right, the idea of showboating about, no, I did more than you, I did, you know, we don't want to see that. I want to see hostages released. I want there to be peace. I don't want to see children blown up on any side of this.
Yeah, absolutely. And let's hope they get it over the line. I mean, Qatar have played a significant role. Whatever we think of this Middle Eastern country, they've played a key role in persuading Hamas to sign up to this. Hopefully they'll get it over the line and we will see some peace. Many thousands of people have been killed as a consequence of Hamas's initial actions on the 7th of October 2023.
Indeed. Simon, stay with us. Simon Danzcuk, the former Labour MP.